Next, we have a panel discussion on specific learning disability. The faculty for the panel is Dr. Priyanka Jain, and the panelists are Ms.Kanaga and Ms.Lakshmi Radhakrishnan. I request the faculty and the panelists to please occupy the dais.
Am I audible? Hello, can you please increase the volume a little bit more? So our panel discussion topic is specific learning disability. I am sure there are many PGs out here. So before starting this before taking it further, I would like to introduce you with the specific learning disability, since there are many PGs out here and we are not being taught these topics like neurodevelopmental disorders in MD pediatrics. We also struggled a lot in the beginning, and then we learned it by doing these practices. Can I have the next slide, please? Yeah. You can change it with this. Yeah. This is a little. So I am working with the Ministry of Social Justice and Empowerment also. We made disability certification and disability guidelines also in 2016 with Dr. Shafali Gulati from AIMS. So what is a specific learning disability? There are many PGs out here. Can I ask someone to give me an introduction of a specific learning disability? What do you know about a specific learning disability? It comes under neurodevelopmental disorder. This is a neurodevelopmental disorder. And most important point for differentiation is that IQ is average or above average. You should not confuse it with intellectual disability. And when we go for testing, vision and hearing both are normal. And we have to exclude socio-economic factors like there are no financial constraints, social environment is stimulating, there are no cultural or linguistic differences like child is being taught in one language only. Many times parents come because there are 3 languages which are being spoken at home. One is speaking like here, Tamil is being spoken, Hindi is being spoken, and English is being spoken, so child is confused. What's the etiology? There is a problem in the wiring inside the brain. So this is due to interaction of genetic, epigenetic and environmental factors. With environmental factors, I mean that home environment is not stimulating. And high-risk newborns, they are quite prone to have learning disabilities. What are high-risk newborns? Can anybody tell me? Any PG? How many PGs are here? No PG. or you people don't want to speak. Okay. So high-risk newborns are newborns who are preterm, who are low birth weight babies, who had severe birth asphyxia at the time of birth, or who were kept in NICU for any reason, or they were kept on ventilator. So they are quite prone to have learning disabilities. You will see many cerebral palsy patients having learning disabilities, many premature children coming with learning disabilities as well. So these processes, this neuronal wiring which is defective in their brain can affect their sensory processing, like they can have problem in auditory processing, visual processing, and tactile processing as well. So their problem can be in reading, which we call as dyslexia, whereas problem is with the decoding of letters. They have problem in recognition of sound, letter sounds, so they cannot form words. And as you are all aware after watching that movie, Amir Khan's movie Tare Zameen Par, that what happens inside the brain in dyslexia. Problem may be with writing, that we call as dysgraphia, or problem may be with numbers, like they can have problem with the subtraction, addition, and division. So we call that as dyscalculia. Prevalence is pretty high. This is around one study was done in Nehmans, and prevalence was found to be around 8 to 12%. Some studies will say around 10%, some will say 8%. So this is pretty high. Like in a class of 100 students, you can see 8 to 10 children having learning disability. So we are just seeing tip of the iceberg. We are really diagnosing a very less number of cases. So this is, dyslexia is very common. This is 80%. This forms 80% of learning disabilities. And then comes dysgraphia, dyscalculia, and dyspraxia. There's difficulty in performing coordinated movements. So how do we approach a case of learning disability? As a pediatrician, when some child is coming to, generally we say that we cannot diagnose learning disability before 8 years of age. But when these children are coming to our OPD, as early as around 2 to 3 years of age, first of all, birth history is very, very important. Birth history to rule out whether this child was high-risk newborn or not, whether he was premature, low birth weight baby, or was having hyperbilirubemia at the time of birth and was on ventilator. Did this child have hypoglycemia at the time of birth, or other histories, you know? After taking proper history, this is important to take a developmental history, milestone history in all the areas. Social smile is very important, and interaction with parents, depending on the age of the child at which you are taking developmental history. Social history, language history, speech and language history, and motor history, both gross motor as well as fine motor. Then rule out any syndromes. If child is having any syndrome, ask for epilepsy and ask for other issues. Rule out other medical conditions which may be responsible for learning issues. Now, we have to see whether this child has average IQ, normal IQ, or above average IQ. For this, we need to refer this child to a psychologist. So clinical psychologist performs IQ test for checking IQ. If we are saying the child has some learning issues, learning disability, if you're suspecting learning disability, then IQ should be average or above average. And now comes the role of a special educator and occupational therapist. Occupational therapist role is in sensory processing disorder, because these children have problem in processing verbal information, like or problem with auditory, with visual, tactile, and there are 5 senses which are responsible for our well-being. Taste, smell, auditory means hearing, visual means seeing, and touch, tactile, which may be deep touch or which may be superficial touch. And a special educator, they play a crucial role in the management of these children in the school. They give remedial classes and they bring out different technologies on one-on-one basis for these children to make them better and to make them do better in life. So now we are very lucky to have this panel discussion as a pediatrician, because pediatricians don't come to know about therapist part. What's the role of a special educator? What's the role of psychologist? What's the role of occupational therapist in managing these children? So we are very lucky to have all of them here. So my first panelist is Ms. Kanaga. She is a psychologist. And Mrs. Lakshmi, she is a special educator, renowned special educator who has worked for so many years with these children. So we will be benefiting here from her vast experience in this field. So the first thing is, how early can we diagnose specific learning disabilities? This is a question in the mind of many. So my first question is from you, Ms. Kanaga. How early can SLD be diagnosed, and how do we differentiate between learning disabilities and learning differences, learning difficulties?
Okay. How early SLD can be diagnosed? So, as per the DSM criteria, the diagnosis cannot be given till 8 years of age, but learning disability can be, or learning difficulty can be assessed as early as 4-5 years old. The Nehmans SLD battery assesses children starting at 5 years old, but from the age of 4, children start showing few early signs, like they have mirror image in writing, they have a lot of spelling errors, they they are unable to like concentrate. So the first early signs will be about some academic difficulty in terms of concentration, in terms of not being able to sit in class. When it comes to writing, they don't want to write. This should be differentiated from their playful behavior as well. So, but if these behaviors are consistent over 4-5 months and the parent and the teacher is finding it little hard only in terms of academics, and they find that there is something, that this child is not able to perform to the 4.5-year-old level, those are early warning signs that can be caught at 4 years. But typically we diagnose at 8 years of age only.
Okay.
So what is the difference between learning difficulty and SLD? I'm going to give you a small example. It's like I fell down and I am unable to walk for a day. I have difficulty in walking, so I'm limping. Versus I met with an accident, I lost my leg, and that's a difficulty. I mean, that's a disability, right? So children with learning disability will have issues in choosing career related to reading, writing, academics. So they'll have to sort of choose an alternate career, or with intervention they may outgrow it, or with intervention they may be able to perform better. So that's the basic difference between difficulty and disability.
Many times we have seen that these children have speech, delayed speech also.
Yes.
At times, till 3 years of age, they are not able to speak.
Yes.
So that must be a challenge.
Yeah. Early warning signs like milestone delay, speech delay, early developmental delays are significant indicators for learning disability as well.
So, ma'am, just as we are discussing about dyslexia, so what are the pointers of dyslexia in preschoolers? Like when we talk about 3 years of age, so what have you experienced? What were the pointers in your experience at that age?
I wouldn't like to label any child with dyslexia, dysgraphic, and all that.
Yeah.
It's not on.
Yeah.
And when you talk to the parents also, if you are going to tell them that your child has a problem, they are going to be very, very worried. But if you are going to tell them your child has certain difficulties, maybe in walking, maybe in talking, maybe in clapping, as we are talking about preschoolers, maybe in answering, maybe in demand language, maybe in understanding a story, maybe in repeating a story. So all these are the pointers why the child is not able to answer a question. So when it comes to the language acquisition, there are two. One is the child internalizes the meaning, but when you demand them, on demand the answer fails. So for a child in preschool, in my experience, there are so many pointers that you can. One is walking. When the child doesn't balance, he is not able to swing, he is not able to climb any tree or a small thing and is scared. All these are the pointers so far as then we can refer them to the autist. Speaking also is a problem, eating. So certain children do not eat certain hard things. In South India, we have muruk. They don't like it because of the texture, and they cannot chew chapatis, parathas. They don't like it. They like only soft foods. So that is also an indicator why the child is not able to do it. The third one is speaking. Why is the child maybe stuttering, maybe this? So you have to, as a special educator, we act as a physical therapist, whom to refer and when to alert, and where does our teaching methods fail. That is very, very important. It is not methodology. When children are brought to preschool, as she was saying, they don't recognize letters, they don't. First thing is speaking. Then comes reading. Last comes writing. But in schools, what comes first? Please tell me. What comes first?
Writing comes first.
Writing comes first. Then how do you expect a child to do a curve letter A when the child is not able to draw a straight line? So we start from the reverse. First is, oh, my child is not able to spell. What is spelling? How many of us can spell committee?
So that means the pointers are, if his speech is delayed, if child is not able to read his name or her
Child
name,
need not write. We are talking
no,
about
we are
a
not
preschooler.
talking about writing. We are not talking about
We are
writing.
talking about a preschooler.
Yeah.
So preschool,
mainly
speech
and motor,
and yes.
oromotor skills, like if child is not able to
Oromotor
eat properly,
skill and of course physical skills. You know whether the
yeah.
child runs, whether
Gross
child.
milestones are important.
Those are the most important one, and speech is one.
Yeah.
But we are not worried about writing.
Yeah, writing we should be worried around 5 years of age, not before that. So, Skanak, there is a big issue that learning disability is a broad term. How do we categorize that into mild, moderate, severe, that this child has so much of problem? So how do you categorize that?
Okay, so to categorize them, I'm going to give you a plain, simple assessment category, right? What the current research that is available at present categorizes them into mild, moderate, severe. But what we ideally say in enhanced SLD is that there should be a 3-year delay. So if there is let's say a child who's in 8th standard, but is able to perform in the assessment only up to 5th standard, then there is a 3-year delay that the assessment measures. And once the 3-year delay is noticed, then the child is supposed to be having.
And you are assessing all the areas like reading, because
So
reading, writing also, and comprehension.
Yes. So NIMANS SLD assesses all the reading, writing, verbal comprehension, etc. that is used for your disability certificate. So anything but here we should also be very cautious here when we say how we categorize them into mild, moderate, severe, is also that, let's say for example a 6 years old comes, right? You can't say that the child will have 3 years lesser, while the assessment itself starts only at 5. So only at so there are assessments that does categorize as mild, moderate, severe, like
do you have certain tests which can
yes,
tell that this child is mild, moderate, or severe? Do we have such kind of tests available?
We do. So, but what is preferred in the government is NIMHANS SLD. But what we do at the clinic, there is also an assessment called Dyslexia Screening Test Junior and Senior that measures about 12 to 13 areas of the child, from spoonerism to phonological category to verbal comprehension to working memory. So there are about 12 categories that the assessment measures, and that assessment gives you the categorization of mild, moderate, and severe.
Okay, wonderful.
Yeah.
Please.
As a special educator, I find mild dyslexics never come to us at all, because they know how to cope. After all, dyslexia is a coping strategy. It has nothing to do with any other intervention, except we teach the children to cope. So mild doesn't come. Moderate, yes, with some help for a year or two, they get back to the mainstream. But severe is something which we have to work for a longer period and look for alternative.
Okay, right. So what is the DSM-5 criteria which we are following for diagnosing specific learning disability?
I think, like you already mentioned, difficulties in reading, writing, math, handwriting difficulty, rule out any comorbid conditions, and intellectual disability and other physical disabilities are also to be ruled out, just to be aware that this child has another disability. Okay. So these are basic
reading,
criteria.
Writing, and arithmetic skills and balance.
Yeah. But predominantly what we need to look at is the reading, writing, math difficulty along with the comorbid conditions and intelligence.
Yeah. ADHD is the most common comorbid condition which is associated with learning disabilities. In almost 40 to 50% cases, we have ADHD associated with learning disability, which makes the task very difficult, for which we will talk later. So how important is the role of counseling of parents, teachers and child after diagnosing dyslexia? Because this news is a very big news for parents as well as for child, that this child has learning disability. So breaking that news is a task. So you have to counsel, these parents, no, not only parents, even child needs counseling. So how do we do that? How do you break that news to parents?
Right. So you are right in terms of how parents start looking at this as a life-threatening.
Life-threatening at times. They don't trust you also. They doubt your, what should I call? Like they don't trust that thing that you are saying right.
Yes, because it's not visible in scans or reports or blood reports, right? So we have no proof other than to show an IQ assessment and a dyslexia assessment. But I'm going to take a little different route here, right? So any child who has had learning problem, let's even forget dyslexia, right? Any child who has had learning problem is already going through a lot of emotional difficulties in the school, right? From bullying to self-confidence to scoring low. Most children come to me and say, I studied for 14 hours, but I didn't get this score. What am I to do? I am disappointing my parents. So I don't know what to do there, right? And at some point, parents also see that this child is putting in effort, but why is it not getting translated into results? And that's when they land up in your clinic, because they are able to evidently see that something is not going okay. So counseling is a crucial factor here. First, I will go step by step. First is breaking the news, right? But in the interview process itself, once you see the symptoms, you will have a significant idea that, okay, maybe this is going into dyslexia. So then I start by first psychoeducating the parents itself, saying that, see, I'm going to test your child for these things. I will rule out comorbidity, I will do an IQ assessment, and I will do a dyslexia screening. So then I educate them saying that we are going to do this, and these are maybe the possible results for this. So the parent is prepared in the first place to listen to you after the results come in. And the second most important factor here is the consent of the child, which goes missing in most clinic cases, right? So most often the child is just brought in and made to sit in front of a psychologist, and all the things that we know about psychologists is psychologists treat mental patients. That's the stigma that is around us, right? And imagine this child sitting in front of a psychologist who probably is going to think, oh my God, probably I'm mad. I am probably not okay. And that's why I'm made to sit here. So first is to address that stress of the child, saying that, hey, I hear from your parents that you probably have some learning problems. And I also see that probably you're also struggling here. So I am here just to help you out here. So I'm going to give you a few assessments, like we'll do games, we'll do some writing at your own pace. Right? We will do as slow as possible, and we will take this as slow as possible, and we will get to that. And once, whether the results are positive or negative, then we will get to it, right? So more than the dyslexia or the learning difficulty itself, the emotions of the child plays a crucial and an important role here, and family support also plays an important role. So you have to work alongside the parents and alongside the child together in a separate system. Like for example, we follow where the child goes for remedial. We meet the parents 3 sessions once or 4 sessions once as counseling and support for the parents, and we also have emotional support for the children, which is an important aspect, I feel. Because if you see, most children are unable to concentrate because there are things that are happening at home that they are unable to cope with. So if you elicit information, they will say, I am seeing my parents fighting, I am unable to concentrate. I have this difficulty. So there are other difficulties also that we have to rule out, not just with diagnosing dyslexia, but other factors, that family factors that come into play.
Yeah, it's It is very important to counsel parents because after hearing this news, generally parents have so much of anxiety, and if parents are anxious, then their anxiety gets passed on to their child. So if parents are anxious, then child will also be anxious. So what we are telling to all the parents, whether the child has autism, whether the child has learning disability or any other neurodevelopmental disorder, that parents have to be patient enough to help their child. They should not be anxious, they should not be worried, they should work towards solution, right? So this is very, very important to counsel parents along with the child.
Can I add one more? Can I add one more?
Yeah, okay.
See, we are talking about acceptance by the parents. How about the school?
The school comes later.
School doesn't accept.
We are coming to that. We are
Okay.
coming to that. We have those questions later. Because teacher counseling is later. Don't worry. Your role will also come. So this is your role. How do you handle such kind of child in the classroom? Because in the classroom, this child is studying with normal children. So what about this child's self-esteem? Because he's seeing, all the time he's seeing that the other child is able to do everything, but this child is not able to finish his homework. This child is not able to comprehend whatever is being taught. This child is not able to copy whatever is being written on the blackboard. So this child has so much of mental trauma, and it's a really a very tough task for a special educator to handle these kind of children. And we are not talking about metro cities. In metro cities, we have enough special educators, but only few crores they live in metro cities. What about other areas where we don't have facilities of special educators and trained professionals like clinical psychologists and speech therapists? So how do you handle such kind of child in the classroom? So we need to train other teachers as well, so that even if there are not special educators in the class, these children can get services of trained teachers. So how do you handle such kind of child in the classroom, and what will you advise to other teachers who are not special educators to handle these kind of children in the class?
Yeah, that's a big struggle because a classroom has got 40 students. It is impossible for a teacher to monitor everyone. So what we do is peer studying. You know, if there is a child who can copy notes for these children and give it to them. So that is also has helped a lot. Second thing is give the notes to the parents so that they can copy the notes. There is no gap. That is also can be done. When the test comes, many children are not able to read the question paper. So reading the question also helps. And condoning the spelling. You don't have to insist on correct spelling, but it is all right. Because these children write run-on sentences. There won't be a full stop, there won't be a comma or anything. So they can give concession to all that. If the content is there, if you can understand that the child has grasped the concept, then give the marks. I'm not saying full marks.
Sorry, I'm interrupting. We will come to concessions later on. I mean to say, how do you
You're
handle
talking
such
about
kind of
classroom, ma'am.
Emotionally in the classroom when they
Emotionally, the
how
children.
do you handle in the classroom?
Yeah, the children, you know, I have sent many children to the mainstream, but I sensitize the teachers, and the teachers in turn sensitize the students, because these children have no other problem except in academics. They may be very good runners, they may be very good athletes, very good in singing, very good in dancing, painting, everything is there, but they cannot write or read. So the children accept them. The acceptance is that. And the parents are also advised to accept them as they are. Acceptance is the key word there. Once we accept, okay, this is what this child needs, he will do it, and you encourage him, they do it. Okay. So parents advertise, this thing also is very comparisons. They should not compare with their peers or at home. Right now I have a student in 10th class, and then this child's artistic ability is far superior. I'm sure he'll become a great portrait artist, but he is having difficulty in talking, he is having difficulty in communication, he is having difficulty in other areas, emotionally disturbed, nightmares, and eating, everything. And postural defects are there after pandemic, and we are going through some physical therapy with him. So this is what the parents are still anxious. They want to push him because he is in class 10. So the advising the parents and counseling the parents. As a special educator, we are not only there to correct make the child go into the mainstream, but our duty also lies in being an emotional support to the parents. We cannot say go here, go there and all that. We also have to be empathetic and then guide them. This is one thing.
Sorry, we don't have occupational therapists right now. Some, some problem happened at the 11th hour, so he is not able to make. So Mr. Raghuram was, otherwise he had to come here for the panel discussion. So I will ask you, ma'am, what is the role of occupational therapist in managing dyslexia? You have worked in the school setting, so where we have
I have worked in the mainstream.
Multidisciplinary approach, where all the therapists work together. So what is the role of occupational therapist?
Very important role. One is postural correction, which is now after COVID, we find the children have become little fat. So, and then they are not able to sit, they are not able to, they squiggle and all that, they are never comfortable. And there are a lot of other spinal problems also I have found out with 2 or 3 children as of now. And this child, the 10th class child whom I was talking about, is now undergoing an occupational therapy and physical therapy because he is not able to sit, he takes a long time to eat, and the parents are all very, very angry with him. And why they brought him, so the role of occupational therapist is very important because right from preschool, you can find out they don't know left and right, they wear wrong chappals, they cannot maintain the rhythm in the class, they cannot sing. So all these are the pointers. And as they grow up, we talk only about handwriting. But why is that they are not able to finish the paper in the examination? For example, 11th class student came to me and his only problem was he was not able to finish the paper on time. So what is the reason? Is there any problem? Again, occupational therapist's role is very important because they can find out why the hand is not moving fast. So there are physical therapy and occupational therapy. They play a crucial role in so far as I am concerned.
Yeah.
Many
and
children
sensory
need
processing disorders, auditory, visual, tactile, and smell
multisensory, it's definitely important.
If you are saying something, they are not able to process that. They have problem in comprehension also. So occupational therapists, they have a role in auditory processing, visual processing, which we call a sensory integration therapy.
Yeah.
And what is multisensory stimulation, ma'am?
Multisensory stimulation is, I think you are referring to it as a kind of a
stimulation of
multiple intelligence.
Like taste, giving them different taste. Giving them, like what we do in OPD is we ask parents to bring itra, like pehle jo itra aate hai na, choti shisha, I don't know what do you call in Tamil, perfumes, but very small bottles. So different types, so that I ask them to put that on child's clothes every day, different kind of perfume on their clothes, so that they can smell different. Their smell system, their olfactory system is stimulated, and taste also. Different flavor food should be given to stimulate their olfactory, their taste sensations. And for auditory, for visual, but this is multisensory stimulation, is a stimulation of all the 5 senses.
One is skin. They don't like the collars. If they have the labels, it irritates them. So some of the textures doesn't suit them. They become very restless when they wear certain type of clothes. So all that also comes under multisensory.
What are the emotional problems with which these children suffer in
fear?
We have talked a lot about it.
Fear of failure.
Yeah. Failure.
Fear of non-acceptance.
Yeah.
And anger. because anger with themselves, because they know the answer, they are not able to answer it, and being humiliated in the class, especially in the higher classes. I had a student in 9th, he came and told me one day that he was going to murder his biology teacher. And one special school in Coimbatore, the child, I went there for some workshop, I found a child with a knife. He wanted to kill one teacher who was asking him to write. It's a special school. Okay? So this anger, uncontrolled anger, is there. The rage is there. Not because of their own this thing, because we are not able to accept it.
So uncontrolled anger, fear, frustration, feeling of rejection, because peers, they don't give that much importance to this child, and child is facing bullying in the classroom. So child's self-esteem is very low. Even at home, all the parents are not that cooperative with the child. They don't think at that level. They are parent and child, they are not at the same space. So there is a conflict of emotions at home also.
One more example I'll give you at the lower classes.
Yeah. Sure.
At the second class level, a child came to me and he was humiliated in the class by the teacher. You know how? He was asked to remove his pants in the class. These kinds of things. So you have to sensitize the teachers. You have to sensitize the parents. There is no point in being severe with them. It's not their... If they can... See, all of us love to be appreciated. Nobody likes to be criticized. So, the same thing is with the children. So, please sensitize your friends, your teachers, and your patients, and the mothers, and the fathers.
Yeah. I just had one line there. Children overthink a lot. So, if you see them actually sitting like this, they will actually be thinking about a lot of things in their household and about their academics. So overthinking is also one of the common emotional problems. And these days we are getting a lot of children with childhood anxiety and depression more than what we saw earlier. So childhood depression and anxiety, if you rule their academics, you will see there has been an undiagnosed dyslexic component there.
So anxiety and depression is also very common these days. Yeah, very common, which remains undiagnosed.
Childhood depression is very
common. Yeah. So, how do you rule out dysgraphia from other causes of poor handwriting? Because poor handwriting may be because of some muscular problems, some local problems. Child may be having poor muscles, fine motor problems. So, how do you rule out dysgraphia?
See, dysgraphia is only a name. Most children do not have a good handwriting. That is because, they have been started to write very early. When the child has to hold a pencil at the age of upper KG 4 years old, a small pencil, they are not ready to hold a small pencil. And we insist on their writing within the line when they are not ready. So there are so many other activities like giving them a big... So dysgraphia is sometimes it's a neurological problem. I had a student at 10th class, he had a neurological problem. So we had to and that was the time when examination provisions were given. So he was given a kind of, right from beginning he had some nervous problem, and the neurosurgeon gave him a certificate and we got him a scribe for that. And for somebody spoke about fits, epilepsy, silent seizures is one thing which you have to be very careful about, and that silent seizures also is brought upon by being very stressed on examination. So I had a student from a school, and that was the first case of a seizure student getting a concession and a scribe from CBSE board. So dysgraphia can be, we have to first find out
She's
why it is.
She's talking about absent seizures. Yeah. Because in absent seizures you will not come to know, and child is not doing well because in between child is having absent seizures. So child is not able to perform well in the studies.
So far as strategies to improve writing skills and all that, first is the finger movements. You have to give lot of finger exercises. Then you have to, நம்ம புளியங்கொட்டை எல்லாம் விளையாடுறது, பல்லாங்குழி, all these things, and even carom board, everything gives you that skill to operate with your fingers, scissors, and so many other things.
Learning disabilities. If a child has ADHD as a comorbidity with specific learning disability, it is very difficult to diagnose learning disability in that case. So how do you diagnose these cases, and which tests are you using so that if we have psychologists,
Hello.
so that if we have psychologists here, they can be benefited from your talk.
See, once a child comes with symptoms of ADHD itself, we will say that we want to rule out SLD, because a child with ADHD will have symptoms of SLD, which is comorbid, right? So we will do the assessment for both things together. But one of the primary or preferred assessment that we do is WISC-4, Wechsler's Intelligence Scale for Children. Wechsler's Intelligence Scale for Children, 4, that will give us 4, that's for IQ, which will give us 4 components. And if you see children with ADHD, generally the working memory component is lower than the 4 components in itself, and that will be shown in their SLD results as well. So then we can correlate for all the things together. One of the other scales that we use is Vanderbilt test for ADHD. There is parent form, there is teacher form. So if the school is supportive, we usually give the teacher also the form. We will speak on phone, understand how the teacher is seeing this child, get the parent form, teacher form, correlate all the results, and then only we give the diagnosis there.
Okay, got it. What are the accommodations for the students with SLD? Accommodations means what are the benefits they are getting in a school? Or in
Accommodations
the
from
state
the
board, CBSE board, what are the benefits they are getting?
one is the scribe. Now it's not only for visually impaired, or so they get a scribe.
Yeah.
That's easy to get.
Yeah.
And the second is the extension of time.
Extension of time.
Calculators.
Okay,
Now I think
calculators.
for high
We can
school
take
they give
calculators
even
if they have
periodic
problem in
tables for
calculation.
chemistry. Periodic tables they are given. And extension of time I've already mentioned. And
No reduction in the marks for
Yeah.
spelling mistakes and
Spelling
grammar
mistakes.
Sir is
They
an
are
expert
condoned.
in learning disability. He has published a book also. He is doing a lot of great work in the periphery.
I've had the pleasure of meeting him years before, and we conducted a workshop for him in that place. So I'm very grateful to him. So these are the accommodations that you get for.
Yeah. So main is they get extended time. They
And
get a
dropping
scribe
of
to read and
language.
write for them. And
One dropping of one language.
Yeah.
If the child is very poor in Tamil, they can get an exemption for. But I think CBSE has introduced another subjects like art, music, or something. You can take that one as that. So language is the main problem for this. When you can't learn one language, why have 3 languages? It's very difficult for them. So testing method, this is how it is going.
and
I'll just add one.
Yeah.
IGCSE also allows laptop to type. You don't have to write exam. You don't have to write exam anymore.
So you get calculated laptop for different types of learning disabilities. And what are the opportunities available for higher studies for these children?
Well, everything, the world is wide.
Do you people know who are the famous personalities who have learning disabilities?
Yeah,
Tom
you
Cruise,
can, you
Dr.
just
Seth-
Google it. You will find
Albert
everyone.
Einstein had learning disability. Abhishek Bachchan has learning disability, he has dyslexia.
Hrithik
But all of
Roshan.
them did very well in life. So this is one motivating factor when you diagnose such kind of case and they are having low self-esteem, they are poor, because otherwise these children are very creative, they are very nice, they are very hardworking. Only one specific area is not doing well. So you need to motivate these children by giving examples that many famous personalities, they had learning disabilities. So what are the opportunities available for higher studies? These children can do wonders.
See, children are very, very smart. I had a 10th class student coming to me, and then he had problems in writing, and he was very intelligent, but somewhere along very spoilt and all that. So then he said, Steve Jobs never qualified, right? He was not good at studies, right? I said, yes, maybe, I don't know. He said, yes, I know all that. So I don't have to. My father is an industrialist. I can run that. I said, how are you going to manage your staff who is much more qualified and you don't understand a word of what they are saying? How are you going to cope? Oh, that's a problem, is it? I said, yes, that's certainly a problem. So these opportunities, there are plenty. I can give you n number of examples how children have been. The child who wanted to murder his biology teacher finally ended up in, for MBA course in England, and then he wanted an exemption because his handwriting was poor. And then what happened was his professor said, why do you want to take the exam without writing on a computer? He said, my handwriting is very bad, I can't write, I have dyslexia and I have dysgraphia, this, that and all. Then he said, all right, you write a passage, then let me see whether you deserve it. He wrote a passage. Then this professor gave him one paper and he said, you read this paper. He just couldn't read the paper. Okay, I'll finish it. And then finally what happened, he said, this is my handwriting, you're not able to do it. Read it, and I'm here as your professor, what prevents you? So that's it. And many children have done, they are very good, well off in future. I have no problem with them. You know, one has become an entrepreneur.
Is government helping in some way? Like
No.
What are the opportunities given by government to these children?
No, not that anything I'm aware of.
Okay.
Parents are not giving letter, you're talking about government. No, because these children don't have anything else, no. There is no visual impairment, there is no auditory impairment, there is nothing neurologically wrong. Only they look healthy, they can walk, they can dance, they can talk. Why will anybody help? Nobody will help.
So nothing from the government.
No, not to my knowledge. If anybody knows, please let me know.
So what are the assistive technologies which can be used for these children? How do you educate these children? I'm coming to the more practical part now. How do you educate these children? What methodology do you use in your practice to educate these? You are teaching them how to read. You are teaching them how to write. What do you apply? Coming to the more practical part.
Yeah, practical part. One is attention focus. So what happens is, no child can sit for 40 minutes and listen. Even we can't as adults. I'm sure many of you would like to walk about because the session is long. And then, so what I suggest is I start with a clock. And the clock for 10 minutes, don't move, just attend, read, listen and repeat whatever activity I give you. After 10 minutes, that is called the attention focus. The next is the diffused focus. The diffused mode, I just ask him to jump up or something, do something else, and then come back, but he still thinks about what he has read as he is moving around. And that is the diffused mode. So this one helps a lot, and slowly you increase it up to 20 minutes. After 20 minutes, these ADHD children cannot concentrate. You can train them to concentrate up to 20 minutes without losing their focus. And they have to repeat and find out how they understand. And this is one thing. Second thing is computer. Third thing is reading out and listening to the lessons already recorded and following it up. And when they read, they miss out the lines, so we encourage them to either follow it with their hands or with the thinking side of the pencil or with a ruler, so that they don't lose the line, and read for just one paragraph, see what you have done, and then do it. So these are all some of the things. And before going into the lesson, we give an overview of what to expect in the lesson. So once they get the overview, they are able to find out what is that paragraph refers to. So some questions you can give beforehand, you will find the answers, and if you can understand this. So it all depends on each one's level of understanding and grasping. There is no one rule that can be applied to everything. That's why I am very scared to say methodology.
There are different sensory methods also, like you can write on child hand, so that child learns by feeling that, we are stimulating all the senses, visual. Like if you are writing Ram, so you are saying that also, so this is auditory stimulation, you are writing Ram, child can read, child can feel that also when you are writing Ram. So this is also one methodology. Teachers are writing on the back also, so that child can feel. This is tactile by stimulating tactile senses. So there are different methods. We are using audio books also for teaching them, which we call as talking books. Our child voice can be recorded, as Madam said. This is by using voice recorder. So there are different methods to educate these children. So I'm just rushing now because I have been said that we are short of time. We cannot select a scribe like that. There are certain criteria for the selection of a scribe. Ma'am, please fast in 2 lines.
One line is, we've already spoken about scribe. There is nothing, no need for us to.
No, a scribe should be
1 year younger than that. One class younger than that. Yeah. That is the criteria.
If a student is in the 10th class, then scribe should be from the 9th class. Corona period was very difficult for every child, because we post-COVID we are getting so many cases of autism which are not actually autism, they are mimicking autism, that is virtual autism, because they was so much of digital, they was so much of a screen, they were on mobile, they were on TV. So that was a challenge during that period, how to diagnose these children. So what was there in your experience? How were you able to diagnose learning disability in that period?
Yes and no. Yes, because IQ was a bit of a problem. We couldn't assess IQ virtually. So diagnosis could not be given till they came to the clinic. Yeah. We were able to assess SLD screening because it involved mostly writing, reading. That we did virtually. But the deficits of academic period, like somebody said, we said give it 6 months period. If the child does not improve, then we will come for a diagnosis.
Okay.
If corona was a significant factor there.
Yeah. Problem? Yeah, it was affected. Yeah, fine. I will just give take home message. This is genetic. IQ is average or above average. They are hardworking and strugglers. Their vision and hearing is normal. They have poor self-esteem and they have problem in auditory, visual or language processing. They have associated behavioral problems, and this is very important to diagnose them timely. Only then we can do better. Thank you all. Thank you.
Thanks for the panelists and all the. Thank you.